Hello everybody and welcome back. Today we're going to be looking at the anatomy of the Pterygopalatine Fossa. We'll review the different structures that make up its boundaries. We'll also look at the foramina that connect the Pterygopalatine Fossa to multiple different spaces within the skull and allow for the passageway of nerves and vessels through these foramina. We'll also name those nerves and vessels, and I think the best place probably to start is to figure out where exactly the Pterygopalatine Fossa is. If we look at a lateral view of our 3D model, we can see a shallow fossa being formed between the neurocranium and the viscerocranium. This is a Pterygopalatine Fossa. Anteriorly, you can see the maxilla, posteriorly, the sphenoid bone, and medially, the perpendicular plate or perpendicular part of the palatine bone. We can see this fossa also lies medial to the infratemporal fossa. It lies deep in the face. If we look at our CT scan and go to a similar level here, find the infratemporal fossa that we've looked at previously. Here's the zygomatic arch. And we go medial to that infratemporal fossa. This small fossa here is the Pterygopalatine Fossa. Anteriorly, our maxilla bone, posteriorly, the sphenoid, and medially, the palatine bone. Now, as you can see, these bones come into close contact with one another, and it's sometimes difficult to separate out these bones in your mind. As a result, I've created this 3D diagram, a simplified diagram showing you the components of the Pterygopalatine Fossa. We can see anteriorly this green structure is the maxilla bone, posteriorly we've got the sphenoid, and medially we've got the palatine bone, the horizontal process as well as the perpendicular or vertical process. The sphenoid bone, we can see a lateral and medial pterygoid plates, as well as the optic canal that runs through the lesser wings of the sphenoid here, and 3 separate foramina that we're going to look at later. You can see that the Pterygopalatine Fossa has this inverse pyramid shape. It goes from wide to narrow as we head inferiorly. Anteriorly here, this represents our maxillary sinuses. We know that superiorly, the maxilla makes up the inferior or the floor of the orbit. And this passageway here is the inferior orbital fissure, which we're going to look at later. You can see on our 3D model, the maxilla making up the floor of the orbit here. What I haven't included in this 3D diagram is the greater wings of the sphenoid, and I'm going to show you later on how they contribute to the roof of the Pterygopalatine Fossa. So let's go back to the CT scan and see how that Pterygopalatine Fossa goes from large to small as we head from superior to inferior. Let's scroll superiorly in the Pterygopalatine Fossa here, and I'm going to show you how we figure out the borders, but let's just look how large the Pterygopalatine Fossa is here. And as we scroll down inferiorly, that Pterygopalatine Fossa gets smaller and smaller and smaller. It narrows down until we reach the horizontal plate of the palatine bone here. So that Pterygopalatine Fossa gets narrower and narrower. We've seen from that diagram that there are 3 bones that make up 3 walls of the Pterygopalatine Fossa, the anterior, medial, and posterior wall. We said that the anterior wall was made up by the posterior wall of the maxilla here. We can see that on our sagittal plane. Here's the anterior border of the Pterygopalatine Fossa. See how that fossa is narrowing down as we head down inferiorly. We can see the maxilla also wraps round and makes up the inferior border of the orbit here, or the floor of the orbit. Medially, we can see on the axial slice, here is the vertical or perpendicular part of the palatine bone. That's making up the medial wall of the Pterygopalatine Fossa. We can see that on our coronal slice here. This medial wall is the palatine bone here. We can see the palatine bone here separate from the maxilla and the alveolar process that we've looked at previously. Posteriorly, we can see the pterygoid process of the sphenoid bone. Those pterygoid processes are heading inferiorly from the body of the sphenoid down into the face. And we know as those pterygoid processes head down further and further, they give off these 2 plates here, a lateral and medial pterygoid plate. Anterior to the pterygoid processes here is the Pterygopalatine Fossa. You see, laterally, there is no boundary wall here. Laterally is actually an opening known as the pterygomaxillary fissure. If we look at our 3D model, where we place this yellow chopstick through this hole here, the hole we're placing it through is the pterygomaxillary fissure. It makes up the lateral boundary of the Pterygopalatine Fossa. So we know laterally, from the Pterygopalatine Fossa, outwards we're going into the infratemporal fossa. To go from the Pterygopalatine Fossa to the infratemporal fossa, we have to pass through the pterygomaxillary fissure here. We can see the pterygomaxillary fissure represented on our 3D model as well here. It's this opening here that's a pterygomaxillary fissure. So we know the anterior, medial, and posterior walls, and we know that the lateral wall is opening out into the infratemporal fossa. The floor of the pterygopalatine fossa is made up by the pyramidal process of the palatine bone. It's part of the horizontal portion of the palatine bone here. In that floor, in that pyramidal process, we've got two separate foramina that we're going to look at later. Now, the roof of the pterygopalatine fossa is a little bit more difficult to appreciate even using this simplified 3D model. If we look at our scan here, we're on our axial slice. Let's head up superiorly and make our way to the superior part of the pterygopalatine fossa. Now, a good landmark to find the superior region of the pterygopalatine fossa is to look for the foramen rotundum here. You can see it on our axial slice, you can see it on the sagittal slice here, as well as the coronal slice if we head out posteriorly. The foramen rotundum is going to supply the maxillary division of the trigeminal nerve, and that plays a major role in the nerve supply that travels through the pterygopalatine fossa that we're going to look at later. If we go to our sagittal scan here, you can see that superior to the foramen rotundum is this bone here, which is the sphenoid bone. This bone extends out as the greater wings of the sphenoid, and anterior to the greater wings of the sphenoid is going to be this opening here, which is the inferior orbital fissure. You can see on the 3D model, the inferior orbital fissure has two boundaries, an inferior boundary made up by the maxillary bone, and a superior boundary that's made up by the greater wing of the sphenoid. If we look on our CT scan here, here's the maxillary bone making up that inferior boundary, here's the greater wing of the sphenoid making up the superior boundary. As I scroll out laterally, you can see that fissure extending out laterally. Here's the greater wing of the sphenoid. Remember, it's making up that middle cranial fossa. And here is the maxillar bone. You can see how the greater wing of the sphenoid is wrapping over the top like this and making up the roof of the pterygopalatine fossa. So that's the roof of the pterygopalatine fossa. We've labeled all of the boundaries now. Now let's have a look at some of the foramina that connect the pterygopalatine fossa to various different spaces within the skull. We've mentioned one here, the inferior orbital fissure. That connects the pterygopalatine fossa to the orbit. We've also looked at the foramen rotundum. The foramen rotundum connects the middle cranial fossa to the pterygopalatine fossa. Now below the foramen rotundum, we've looked at a canal previously known as the Vidian canal. This is also called the pterygoid canal. The Vidian canal or pterygoid canal connects the pterygopalatine fossa to the foramen lacerum as well as the carotid canal here. And you see why this anatomy is important when we look at the nerves later on. So we've seen the foramen rotundum, we've seen the pterygoid or Vidian canal. If we head slightly inferior and more medially, we're going to see a third opening traveling through the sphenoid bone. This is what's known as the palatovaginal canal or the pharyngeal canal. The pharyngeal canal connects the pterygopalatine fossa to the pharynx here. So there are three foramina running through the pterygoid process of the sphenoid bone. If we have a look at our 3D model, we can see those three foramina here. We've got the foramen rotundum, the Vidian canal or pterygoid canal, as well as the palatovaginal canal or the pharyngeal canal. Superiorly, what I've represented here are the lesser wings of the sphenoid, remember, making up part of the anterior cranial fossa. And we can see the lesser wings of the sphenoid have the optic canal running through it. That's superior to our pterygopalatine fossa. Inferiorly, or at the bottom of the pterygopalatine fossa, we've got two separate foramina running through the palatine bone. This is what's known as the greater and lesser palatine foramina. They connect the pterygopalatine fossa to the oral cavity. Let's have a look at that on our scan. Let's scroll down inferiorly through the pterygopalatine fossa. As we head more and more inferiorly, we're going to see two separate foramina forming. Anterior is the greater palatine foramen, and posterior is the lesser palatine foramen. Let's have a look at that on our sagittal scan. I'm going to scroll all the way across to the greater and lesser palatine foramen. You can see the greater palatine foramen here extending into the oral cavity, as well as the smaller, lesser palatine foramen lying posteriorly here. Posterior to that are the medial and lateral plates of the pterygoid bone. You can see how close contact we have between the palatine bone and the sphenoid bone here. Now we've got one more opening to mention, and that is in the superior medial portion of the pterygopalatine fossa. Let's head up superiorly, and we can see the palatine bone on the medial surface here. That palatine bone, part of it is going to come to an abrupt end. Above the palatine bone is going to be an opening that connects the pterygopalatine fossa to the nasal cavity. Let's head up more and more superiorly until we see that palatine bone disappear. This opening on the medial surface on the superior aspect of the pterygopalatine fossa is what's known as the sphenopalatine foramen, connecting the pterygopalatine fossa to the nasal cavity. If we head over to our 3D model and I pass this yellow chopstick through the nasal cavity, and then we look at the pterygopalatine fossa from a lateral view, you can see the tip of that chopstick through the sphenopalatine foramen. So medially we've got this sphenopalatine foramen, and laterally we've got the pterygomaxillary fissure here. Now these foramina and fissures become extremely important when figuring out the nerves and vessels that are passing into and out of the pterygopalatine fossa. So let's first have a look at the arteries that travel through the pterygopalatine fossa and how they connect to the different spaces in the skull. I think the best way to appreciate how the blood vessels travel through the pterygopalatine fossa is by using the simplified 3D diagram. Now the major blood supply to the pterygopalatine fossa is the maxillary artery. Now the maxillary artery is a branch of the external carotid artery. Let's have a look at a time of flight MRA and see that maxillary artery. We're here at the level of the nasal cavity. We can see the lateral and medial pterygoid muscles, the internal carotid artery here. We've got 3 different branches from the external carotid artery. This branch is the superficial temporal artery. We know that artery that travels up superficially anterior to the ear. You can feel that artery if you place your finger here. That's one of the terminal branches of the external carotid artery. Another terminal branch is the maxillary artery that we're going to look at today. Let's scroll down inferiorly. Here is the maxillary artery extending through the parotid gland and running either deep or superficial to the lateral pterygoid muscle. The maxillary artery is going to make its way to the pterygopalatine fossa. We know that the maxillary artery also gives off a branch, and this branch is something we've looked at before. This branch is the middle meningeal artery, which is going to travel through the foramen spinosum. I don't know if you can remember that from our neurocranium talk. We can follow that middle meningeal artery and see how it runs on the internal surface of the cranium here. That's the one that we talked about when we looked at the pterion and how the middle meningeal artery is susceptible to being ruptured if we get a fracture at the site of the pterion. So let's scroll back down to the middle meningeal artery. I've gone on a little bit of a tangent there. Here's our middle meningeal artery heading out towards the pterygopalatine fossa. See how it enters the pterygopalatine fossa here, and it's going to give off multiple branches that are going to be difficult to see on this scan. We may be able to see 1 or 2 branches. We can see a very faint branch going into the floor of the orbit here, and we can see some branches coming medially here. Let's go back to our diagram and see the branches that come off the maxillary artery. First, I mentioned that middle meningeal artery that's going to run through the foramen spinosum and head up onto the internal surface of the cranium. Now that we're inside the pterygopalatine fossa, we get our first branch that runs through the inferior orbital fissure and runs along the floor of the orbit. The floor of the orbit again is made up by the maxilla. This is what's known as the infraorbital artery. Now the infraorbital artery gives off 2 branches, an anterior and a middle superior alveolar artery. We also have a separate branch coming off the maxillary artery here, which is the posterior superior alveolar artery. So we've got an anterior, middle, and posterior superior alveolar artery. We then have a branch that heads down inferiorly, bifurcates, and heads through the greater and lesser palatine foramina respectively. This is what's known as the descending palatine artery, and it separates into a greater palatine artery and a lesser palatine artery. The next branch coming off this maxillary artery is the sphenopalatine artery that goes through the sphenopalatine foramen. That supplies blood to the nasal cavity. When we get nosebleeds, often those nosebleeds are coming from these vessels here. We also have an artery going through the Vidian canal as well as a pterygoid canal. So the arteries are basically named by the foramina that they pass through. Now the pterygopalatine fossa is a small space. We've already filled it with arteries. We've still got to consider the nerves that travel through the pterygopalatine fossa. Now you may have noticed I've included a separate structure within the pterygopalatine fossa. This is what's known as a pterygopalatine ganglion, and that's going to become important later when we look at parasympathetic supply to the structures of the face. Now the main nerve that's passing into the pterygopalatine fossa is the maxillary division of the trigeminal nerve. We know that passes through the foramen rotundum. Let's have a look at our scan again. Go up to the level of the foramen rotundum. The foramen rotundum we've looked at previously transmits the maxillary division of the trigeminal nerve. That then becomes the infraorbital nerve that travels through the infraorbital groove, infraorbital canal, and out through the infraorbital foramen. We've looked at that in the previous talk. So we know this nerve passing through, giving off our infraorbital nerve. There are other branches from this maxillary division though. The first branch is the one we've looked at, traveling through the inferior orbital fissure, giving off an anterior, a middle, and a posterior superior alveolar nerve. This is mirroring the arterial supply that we've looked at now, but these are all coming off the infraorbital nerve. The second branch again mirrors what we looked at in our arterial supply. We have a lesser palatine nerve and a greater palatine nerve now descending as two separate nerves and traveling through their respective foramina. They're going to supply sensation to the hard palate here. We then have a separate branch that branches off the maxillary division of the trigeminal nerve as it travels through the foramen rotundum and heads towards this ganglion here. It heads towards this ganglion and then the nerves travel on multiple different paths. We've got a branch that heads through the sphenopalatine foramen into the nasal cavity. That's what's known as the nasopalatine nerve. We have a zygomatic nerve heading away towards the zygoma. And we've got a nerve that travels now backwards through the pharyngeal canal towards the pharynx. These are all divisions of the trigeminal nerve. They're V2. They're the maxillary divisions of the trigeminal nerve. You can see now how V2 supplies sensation to the structures of the face. Notice how the pharyngeal nerve is traveling from anterior to posterior. That nerve is traveling out of the pterygopalatine fossa. If we look at our scan, this is where the maxillary division of the trigeminal nerve is going to enter the pterygopalatine fossa and give off all those branches. One of those branches that we've just mentioned now is going to head into the pharynx through the pharyngeal canal or through the palatovaginal canal, out in towards the pharynx here. Now, how are we getting sympathetic and parasympathetic supply to the face? We know that that's not coming from the maxillary division of the trigeminal nerve. Sympathetic and parasympathetic supply needs to come from somewhere else. The sympathetic supply coming from the sympathetic chain and the parasympathetic supply coming from the facial nerve. Let's look at how that enters the pterygopalatine fossa. Firstly, we have a nerve called the greater petrosal nerve. This is a branch of the facial nerve, and we're going to look at the pathway and the branches of the facial nerve in detail in a later talk, but this is one of the branches, and it has parasympathetic supply traveling towards the pterygopalatine fossa. It's joined by a separate nerve known as a deep petrosal nerve. These are petrosal nerves that are traveling through the petrosal portion of the temporal bone. This deep petrosal nerve is actually a sympathetic supply coming from the sympathetic chain at the level of T1. Those sympathetic nerves head up from the sympathetic chain and synapse at the superior cervical ganglion before giving a postsynaptic nerve that travels around the carotid, that sympathetic carotid plexus. If we look at our scan here, we can see where the carotid artery travels through the petrous portion of the temporal bone. That carotid artery has sympathetic nerves in that sympathetic plexus traveling along with it. Now the greater petrosal nerve and the deep petrosal nerve travel through this petrous portion and they reach the foramen lacerum here. That's where they combine to form the Vidian nerve. And that Vidian nerve is going to travel through the Vidian canal into the pterygopalatine fossa. If we have a look at our diagram here, we'll see those nerves uniting, forming the Vidian nerve. Now you can see that Vidian nerve is going to synapse in this pterygopalatine ganglion here. Now these synapses are formed by the parasympathetic supply from the greater petrosal nerve here. This parasympathetic supply then has a postsynaptic nerve that's going to travel along the branches of the maxillary division of the trigeminal nerve. These postsynaptic branches that now hitchhike along the V2 division is what allows us to get parasympathetic supply to the face. If you think of the lacrimal gland, for instance, it needs parasympathetic supply, and this is how it happens. The sympathetic supply that is traveling from the deep petrosal nerve is not going to synapse at this ganglion. It's already a postsynaptic nerve, but it's also going to follow the various different pathways to various different structures of the face that need sympathetic supply. So this is a basic overview of the nerves that travel through the pterygopalatine fossa. As you can see, if you know the boundaries of the pterygopalatine fossa and you know the openings, it's quite easy to figure out where the vessels and where the nerves travel as they head into and out of the pterygopalatine fossa. Hopefully this talk has given you some conceptual understanding of how this fossa is formed. It's a very small space, but you can see it connects to the orbit, it connects to the nasal cavity, connects to the oral cavity, connects to the infratemporal fossa, the middle cranial fossa, the pharynx. There's so many connections, and when we have pathology, we can see how pathology can travel through these various different openings and why knowing this anatomy is important. Now, if you want to test yourself on this anatomy, any head and neck and neuroanatomy, I've linked a question bank below that you can test your knowledge, figure out what you know well and what you don't know well. Otherwise, I'll see you all in the next talk. Goodbye, everybody.